this is something that's kind of not a nagging ache or pain. This is from an injury. And typically patients may come in and say, I fell and broke my wrist. Now what do I do? So a broken wrist is the most common orthopedic injury. And the reason why it's the most common is, we often trip and fall, whether it's from a route on a trail or the edge of a sidewalk, or we stumbled in the night. And a defense mechanism that human beings have is when we fall, we put our arms out to try and protect our face and head. And that's a good defensive mechanism. No one likes concussions or brain injuries. But one of the consequences sometimes is if your bones are a little weaker, or if you fell in a certain way, you may break your wrist. So this is the most common broken bone that I take care of. It's something I deal with on a daily basis, and something that I do surgery for usually a few times a week. So it's pretty common. I think if we didn't talk about it a little bit, I'd be remiss. So the big question is the break displaced or non-displaced? And what that means is, if you look at this picture, these red arrows are they're showing you a crack through the bone. But you can see the edges of the bone are still nice and smooth. And overall, the fracture is lined up, or the bone is lined up just like it should be. There's just a crack through it. So that's what we would call non-displaced, or not out of place. This is an x-ray, kind of a side view of the wrist. And if you look here, you can kind of much more clearly see that, if we follow this part of the bone up, it takes a sharp step off here, and then it kind of restarts over here. And you can see kind of in the back, there are some small pieces of bone. So this is what we would call a displaced fracture or a displaced break. So that's kind of the next that's the big thing. Is it in place? Is it out of place? That's the question. So if it's non-displaced, it usually does not need surgery. Typically, these can be treated in a cast. I usually recommend doing a cast because it will give more stability to that bone and give it a better chance of healing without moving at all if it's in a cast versus like a removable brace. So, there are caveats to everything, but if it is not out of place, typically do a cast. And the cast will immobilize the wrist, but all the fingers are free, your thumb is free. It really just keeps the broken part immobilized so it can heal up well. If it's displaced, I will probably recommend surgical fixation. Especially if you've already been to the emergency room and they have tried to set it and it hasn't been successful. Surgical fixation, again, it's the most common broken bone that I fix with surgery. So what that involves is about a 2-inch incision, kind of at the end of your forearm or at the beginning of your wrist. And what I do is I make an incision and I go and find the pieces of broken bone, and then I put the bone back together and then hold the bone together in its proper position with a plate and several screws. So that plate is buried underneath the skin, underneath the muscles and tendons that go along your wrist, and it's right on top of the bone. So it's not something that typically patients feel. It doesn't go across the wrist joint, so it doesn't restrict your motion. But it is a surgery, and it's something that certainly has some recovery involved. So this is a surgery that can also be done as an outpatient. Typically, you come in, have surgery, go home the same day. There are certain reasons why I may need to do in the hospital, but obviously we would talk about that Typically after surgery, you're in a splint, which allows for any swelling that may occur. And that splint stays on for about 12 days or until I see you in the office for your follow-up appointment. And then as long as everything has gone according to plan, and I would say this is true for 90 or to 95% of wrist fractures that I take care of, is that plate and screw construct is strong enough that I do not need to put you in a cast after surgery. Instead, what I do is I put you into a removable wrist brace, similar to that carpal tunnel brace I showed earlier. It's something you can take on and off to, do hygiene, wash your hands, that sort of thing. And then I also start having you move your wrist back and forth gently, just on your own power, to start getting some of that motion back. This is the sort of thing where I expect the pain to improve a week to 2 after surgery. You may have some stiffness probably for 2 to 3 months after surgery, but after that, generally your wrist motion returns to normal. And that's really the whole reason why we do the surgery in the first place, is if we were to leave that bone crooked or really out of place, it would alter the biomechanics of your wrist, and you'd probably lose a significant amount of motion at the wrist. So this is something that I think can be quite helpful, especially for patients in the central organ area who are very active, which I am very happy for and encourage. So that's just a little bit about wrist fractures. I will say I have a couple questions related to wrist fractures. One of which, and I get this question very frequently, is does the plate need to be removed? Short answer, no. The plate is buried underneath the skin, underneath the muscles. It does not need to be removed unless there is a problem with the plate, or if you find that that plate is bothersome. That can happen, especially if you're very thin at the wrists, and you may feel the plate, but it's very uncommon that I need to remove these types of plates. These types of plates, luckily, are very well contoured. They've been very well designed. They're pretty low profile, so it's not very common that I need to go in and remove the plate after the bone has healed. If I do need to remove the plate, there's a couple different reasons. Sometimes the screws can irritate the tendons. When I do the surgery, I'm very cognizant to make sure those screws are the proper length to avoid that. But I don't usually remove the plate, definitely until that bone is all the way healed, and usually not before like 6 or 9 months after you've had the first surgery. So I hope that helped. I think if you have had a wrist fracture in the past, you have the plate, and you're thinking about having it removed, I think talking with myself or your hand surgeon who fixed your wrist fracture to make sure that the plate is actually what may be causing some of your soreness or aches, making sure that that is the issue before you go in and have that plate removed, if it may or may not help. So any exercises to help, relieve soreness or increase your strength. This is something I typically defer to the hand therapist. I do not always send patients to physical therapy or hand therapy after they've had a wrist fracture. I kind of take it on a case-by-case basis. I don't like patients to start any strengthening until 6 weeks after we've done surgery, because I want to give that bone a good chance to heal and let it get nice and strong before you start using the muscles around the wrist.